Today, we are diving deep into a topic that's absolutely critical for anyone expecting a baby or planning a family. We're talking about hypertensive disorders in pregnancy, or HDP. It sounds complicated, but trust me, we're going to break it down so it all makes sense. So, you might be wondering, how big of a deal is this really? Is a little high blood pressure during pregnancy just a small bump in the road, or is it something more? Well, the short answer is, yeah, it's a common complication, and the stakes can be incredibly high. All right, let's get the official definition out of the way. HDP is basically high blood pressure. We're talking a reading of 140/90 or higher that shows up at any point during pregnancy, during labor, or even in that postpartum period after the baby arrives. That 140/90, that's the magic number doctors are always watching out for. And let's be super clear about why they're watching for it. This isn't a minor issue. HDP is one of the biggest reasons for serious illness and even death for both mothers and babies all around the globe. That's why understanding this is so important. It's empowering. Okay, but here's the thing. It's not as simple as just having high blood pressure. HDP is actually a whole spectrum of different conditions. And to really get it, we need to look at the 5 main ways it's classified. And this is a really crucial point to remember. Not all high blood pressure in pregnancy is the same. The when, the what, the how, it all matters, and it changes everything about how it's treated. First up, we've got gestational hypertension. So this is when high blood pressure pops up for the first time after the 20-week mark of pregnancy. But the key feature here is what's missing. There's no protein in the urine. That's a great sign because it tells doctors that other organs aren't under stress yet. And the best part, it usually just goes away after the baby is born. Next, we have the one you've probably heard about, preeclampsia. Now, this is a bigger deal. It's not just about the blood pressure anymore. It's that high blood pressure plus signs that other parts of the body, like the kidneys or the liver, are starting to get stressed out. So, how do they diagnose it? Well, you can kind of think of it like a simple formula. Step 1 is the high blood pressure reading. But you need a step 2. You need just one other sign to go with it. The classic sign is protein in the urine, but it could also be things like low platelet counts or even symptoms you can feel, like a bad headache or changes in your vision. And even within preeclampsia, there are levels. With mild preeclampsia, the blood pressure is elevated and doctors will monitor you very closely. But when it crosses over into severe, we're talking a BP of 160/110 or higher, that's when you see those really dangerous symptoms, like killer headaches or seeing spots. The risk level just shoots way up. And if that severe preeclampsia isn't managed, it can escalate to the most dangerous form of all, eclampsia. This is when the stress on the body becomes so intense that it triggers seizures. There's no other way to put it. This is an absolute medical emergency. Okay, number 4 on our list is chronic hypertension. And with this one, timing is everything. This is high blood pressure that someone already had before they even got pregnant, or that's found really early on, before that 20-week mark we talked about. And finally, for our 5th type, things can get complicated. You can have preeclampsia superimposed on chronic hypertension. This is exactly what it sounds like. It's when someone who already had high blood pressure starts to develop all those warning signs of preeclampsia on top of it. As you can guess, this combination puts them in a very high-risk category. So we've got these 5 different types. But what's actually causing all of this? Where does it come from? Well, the science points overwhelmingly to one single culprit, the placenta. The best way to think about it is like a chain reaction, a real domino effect. It all starts with the placenta not developing quite right. That first domino falls, leading to reduced blood flow. The struggling placenta then releases toxins into the mom's bloodstream, which is the next domino. Those toxins cause blood vessels all over her body to tighten up and constrict. And that's the final domino that leads to skyrocketing blood pressure and potential organ damage. Okay, so now that we get the what and the why, let's get to the most important part of all of this. What do you do about it? Let's talk about the signs you absolutely need to watch for and how medical teams step in to manage it. All right, everyone, listen up, because this is huge. These are the red flag symptoms: a severe headache that just won't quit, seeing spots or having blurry vision, a sharp pain high up in your abdomen, right under your ribs, or sudden, really dramatic swelling in your face and hands. These are not just normal parts of pregnancy. If you experience any of these, you need to call your doctor right away. And the reason you have to act fast is because the risks are very real for both mom and baby. For the mother, we're talking about seizures, stroke, or organ failure. For the baby, because the placenta isn't working right, it can lead to slow growth, being born too early, or other very serious complications. I know, that sounds terrifying, and it is serious. But, and this is a really, really big but, there is a clear, well-established plan to manage these risks. This isn't something that doctors are guessing about. They know what to do. So what's in that medical toolkit? Well, it starts with super close monitoring of blood pressure, urine, and the baby's health. There are medications to help control the blood pressure, and a drug called magnesium sulfate, which is amazing at preventing seizures. If the baby might need to be delivered early, they can give steroids to help the baby's lungs mature faster. But ultimately, all of these are just management tools. The only true cure is to deliver the baby and the placenta. So, with all that on the table, let's look forward. What can be done to lower the risk in the first place? And what are the biggest things you need to walk away with today? For people who are at a higher risk, taking proactive steps can make a huge difference. The absolute foundation is early and regular prenatal care. On top of that, your doctor might recommend things like a healthy diet, taking calcium, or even a daily low-dose aspirin, which research has shown can seriously cut the risk of preeclampsia for many people. You know, when you boil it all down, it comes back to one simple, powerful idea. The absolute key is finding it early and managing it properly. This is exactly why those routine prenatal checkups aren't just something to check off a list, they are your single most important line of defense. And that leads us to the most crucial point of all. In this entire journey, your two most powerful tools are knowledge and communication. Understanding what's happening in your own body, knowing what to look for, and talking openly with your doctor, that's what makes all the difference. So what's the biggest takeaway from all of this? It's that your voice matters. You are the expert on your own body. Knowing when something feels wrong and having the confidence to speak up about it can literally change everything. So the real question I want to leave you with is this. Are you ready to be your own best advocate?